Namaskar, Sat Sri Akal, Adab. Good morning, good afternoon, and good evening to all of you. Thank you for joining our live session today. My name is Kunjan Mawar. I'm your host or those for today's FB live session. Well, if you are Indian origin, living in US, and if your parents are visiting from India, you are looking for medical consultation, eGlobal is the answer. They have different packages for you that provide access to doctors from USA and India. Specialty services, prescription will be provided. They get back to you within 1 to 3 days. Family members can participate via live video consultation anywhere in the world you are living. Video consultation is about 30 minutes, no restrictions on pre-existing medical conditions. In-app messaging with doctor after consultation, ID portable, and health passport. In today's Facebook live session, we will be exploring and providing more information about women's health with Dr. Maya Nambisan. Dr. Maya, she's a board certified OBGYN with master's degree in public health. She has a degree in literature from UC Berkeley and completed her medical school, University of Illinois. Received her master's degree in public health from Yale University. When she's not doing OBGYN stuff, she's painting, dancing, spending time with the family and kids. Welcome to the FB show, and tell me, what else are you hiding up your sleeves?
Thank you, Kunjan. It's great to be here. Oh my God, what can I tell you? I have a lot of things up my sleeve. Try asking me some questions and finding out.
Wonderful. Well, thank you for joining. I know you're super duper busy. Really appreciate giving us your time and educating us on this important topic. You know, women ka topic aisa hota hai, we don't get to talk that much openly. So I'm sure a lot of people will be benefiting from today's topic. So are you ready? Should we start?
I am ready. Let's get going.
Okay. Perfect. So my first question to you is a very general question, like, you know, wherever we visit our family physician or OBGYN or any doctor, they usually ask about family medical history. So how important it is for a gynecologist to know everything about your family history and about your history?
It's absolutely crucial. And that's why we take a family history. For instance, certain things are inherited in families, not only diseases, but also things about the cycle, about how we go through menopause and the changes of life. When it comes to OB, you know, deliveries and things like that, like how quickly you deliver, how you handle pregnancies, all of that can be inherited. So that's why family history is very important. Equally important, I would say, is, you know, like a social history. So knowing what sorts of things you do in your life, what sorts of exposures you've been exposed to, I guess I should say, what sort of work you do, what medications you take. The medications you take can have a lot of effect on how you cycle, whether you're able to get pregnant or not. So yeah, it's very important to get a full medical history. That's one of the first things that we learn in medical school, and it truly is crucial, and we use it every day. Yeah.
Wow, I did not know that it plays such an important role. So how often, now that we know that family history is really important, but how often should one get annual screening?
So an annual exam by definition is annually done once a year, but not everything is done every year. The basis of an annual exam would be a breast exam, a pelvic exam. That's the basis of an annual exam by an OBGYN. And the pelvic exam consists of a pap smear as well as an exam of the ovaries and the uterus, but the pap smear does not need to be done every single year. Annual exams should start for most women at age 21, because that's when we start our cervical cancer screening. So that is, the pap smear is our cervical cancer screening. So yes, an annual should be done every year to check on breast and pelvis, but a pap smear, that varies. That varies between different age groups. Yeah.
Wow, that's wonderful to know. Okay, so since we were talking about cycles and stuff like that, I'm going to go to my next question, which is menstrual cycle changes. What is considered normal and what is considered abnormal in the cycle?
a normal cycle, a typical cycle, the one that we look for is a 28-day cycle. And it usually lasts about 5 to 7 days. It's not very heavy. It's not very painful. A typical cycle, the range of a typical cycle would be between 21 and 35 days. So anytime you fall between those numbers, you should be okay, because everyone is different. And as I said before, your exposures, your daily life, everything that you do every day affects all parts of your body and your cycles and your fertility and your reproductive system as well. So things that would not be normal would be very heavy periods causing fatigue, causing anemia, things like that, okay? Typically, we say if you're changing a pad or a tampon more often than once every hour, then that is abnormal. Also, if your periods go on for more than 8 days, that would be considered abnormal. It is normal only to have a period once a month. You shouldn't have a period more than once a month. Going by that 28-day cycle, okay? Painful periods. Now, a certain amount of pain is normal in a period, but excessively painful periods where you can't do your normal activities, that would be considered abnormal. And we always appreciate that there's a range when we're talking to people, because like I said, everybody is different. So what would be a painful period for one person could be quite tolerable for another person. And so we have to take that into account too. It's really pain and bleeding that interferes with your daily activity and does not allow you to live your life comfortably and happily. That's what I would say.
Okay, that's a wonderful way to put it. So having a cycle, whether it's painful or whether it's heavy, as long as we are able to do our daily chores, is considered normal.
It can be. I mean, we look, as long as it's not causing fatigue or anemia, we have to consider that as well. But many women are able to manage and tolerate things like that for many years and come in later on for other problems and find out that this particular thing may not be as normal as they thought it was.
They thought, right. Okay,
right.
Wow. Okay, wonderful. So when somebody comes for annual screening to you, are these questions that you would ask them, like how would I know that, oh my God, what I considered normal is actually not normal?
Yeah, so usually when someone comes for an annual exam, the first thing that happens is we give them some sort of an interview or a survey, or they fill out paperwork, right? And so they put down, in addition to their family history, their social history, they put down their information about their cycles. But that is a crucial question. Whenever anybody comes in, that's one of the things that I start with on their annual exam is, what are your periods like? Do you feel it's too heavy? Have you ever suffered from anemia? Do you have to take medication because your periods are so painful? And how many days of your cycle are painful? Those are some of the basic questions we ask. Yes.
Okay. So how can somebody tell that they have anemia? Would they know in advance, or how would a normal person like me would know that, hey, am I anemic or not?
Yeah, so it's hard to know. And again, because there's many different people out there and many different people can tolerate different things, it may not always be obvious, but some of the signs of anemia is fatigue. Depression can be a sign, being short of breath when you're doing things. You can notice changes, physical changes, like dullness to the hair, dry skin. So things like that could also be manifestations of a severe anemia as well. Yeah.
Okay. So I have a scenario. This is a question that we got from one of the viewers, and so this is a question for a daughter from a mom. So the daughter is 11-year-old. The mom said that the periods are not regular. There are gaps, 2 months, 3 months, and then her last periods were 4 months ago. That was in January sometime, she mentioned. And then she said the period hasn't stopped. So is this due to hormonal changes because this is the beginning of the cycle, or should she see a doctor to get the medication?
Right. So initially, what you were saying about skipping a period, maybe 2 months or so, that can be normal, especially at the beginning of the cycle, what we call menarche, when the period starts. And the reason for that is that we get a period because of ovulation, dropping an egg in the body. That is our timer that our period is going to start a couple weeks later. So if that doesn't happen, then you won't get a period. Well, in young girls who are just starting to menstruate, sometimes the signals from the brain to the ovaries to have you ovulate, that doesn't happen all the time because that signaling pattern or pathway is immature still. So skipping periods every couple of months, maybe 2 or 3 months at a time, that can be normal. When it is not normal is when the period that comes afterwards is very, very heavy or prolonged. That still could be part of the same process, but at that point, I would recommend an intervention because it's never good to bleed for that long, and it does affect her activities. I'm sure it does, and her ability to do what a normal 11-year-old does.
Yeah. Okay. So, mommy, if you're listening, it's better to consult a doctor right away, right?
Exactly, I would.
Okay. So, are there any side effects if something like this happens to little girls?
Well, like I said, prolonged bleeding could, again, lead to anemia, and it could interfere with her daily activities. But something like this happening may not cause sequelae or complications further down the road, because if it's part of that normal process of what we call the hypothalamic, in the brain, pituitary axis, the pathway, signaling pathway to the ovaries, then over time, usually things will correct itself. Sometimes skipping periods every couple of months or so, or more than a couple of months, and then having these really heavy periods afterwards is a sign of a syndrome called polycystic ovarian syndrome. And it's really hard to know, oh, you froze for a second. It's really hard to know if this is happening early on just due to immaturity, or if it's something that's going to continue. And that's why regular checkups with your doctor is really important. And checking the cycles and monitoring the cycles are important.
Got it. So is this something that needs to be monitored with the young girls, like 11-year-old that we had, or is this normal in someone who is 35 and over, or is there an age limit?
Yeah, so typically 5 to 6 years after menarche, like I said, the start of the periods, that pathway, that signaling pathway matures. And so after that, so typically I would say about 17, 18, things tend to mature, and you should have regular periods, as we talked about, once a month, every month. If you skip periods after that, yes, I would seek medical advice, because that could be a sign of a further underlying problem.
Got it. Okay. So switching gears a little bit, is it advisable to get uterus, ovaries, etc. surgically removed after the menopause if there are no medical problems?
I would say probably not. There's no reason to do a surgery to remove your uterus and ovaries, and definitely not the ovaries. The uterus after menopause, I can understand that there may be some question about that, because obviously you're not using it anymore, you're not having cycles anymore. But the ovaries actually persist in giving some hormonal protection up till age 65. Particularly for the cardiovascular system. So it's best not to remove the ovaries before 65. And in women who come to me for hysterectomy, who have indications for hysterectomy, I don't remove the ovaries, and I don't recommend that they remove the ovaries prior to 65 unless they have some medical history, family history of cancers or other problems with their ovaries. Yes, the uterus is not used after menopause, but a surgical removal seems quite an invasive step, and there's no real risk to having your uterus retained in the body. So removing those organs simply because they no longer function for you is not something that I recommend.
Got it.
Okay.
Okay, so until they possess any problem, just leave them where they are.
Right, leave them alone. They're not hurting you.
Yeah. Yeah, that's wonderful. If they're not, if they're not useful anymore, they're not harmful also. So just leave them where they are.
Exactly.
Okay,
Yes.
perfect.
Yes.
I love how you put things together in perspective for people like me who understand it. Very common, very simple language. So thank you for boiling it down to my level of understanding. So women see a lot of yeast infections or UTI infections, So what is considered normal? Like, is it normal to have these kind of infections or something alarming, something going on? So shed some light on that.
So a woman will typically have maybe a few throughout the year, particularly at certain times of the year. And depending on what they do. For instance, a woman who's very physically active and sweats a lot, they may have more of these. And depending on what climate they live in, a tropical climate, they may have more yeast infections. But to have recurrent yeast infections once every month or more, that's abnormal. And you should, again, seek medical counsel to look for underlying causes. And exactly the same with the urinary tract infections. Yeah, sporadic urinary tract infection, nothing to worry about, though it is abnormal. All of these are abnormal things. And they should be treated because there could be complications of a urinary tract infection that are quite severe. But, once in a while, that's fine. If you have recurrent UTIs, you need to have that looked into. Yes.
Okay, perfect. So this is a question coming from a mommy. She's expecting. So she wanted to know, is it normal, when she sneezes and when she laughs, a few drops come down. So is it normal to have something like that?
In pregnancy, it's very common. So whenever anybody asks me about urine loss and they ask me if it's normal, I always say, well, what do you mean by normal? Is normal common or is it like something that's wrong? And urine loss can be very common. It can be common in pregnancy. It can be common after having a few pregnancies when you cough and sneeze. But again, if it's just, a drop or two, and especially during pregnancy, where it most likely will go away after delivery, then I don't think it's anything to worry about. But if you have, more than a cup or so, or, your entire underwear is wet, and that happens repeatedly, especially outside of pregnancy, that needs to be looked into. Yeah. So if you think about it, in pregnancy, you have this baby, and depending on what stage of the pregnancy you're in, there's a lot of pressure on the bladder. There's also a little bit of prolapse or loosening of the organs moving down. And so that can cause some of that loss of urine. Yeah.
Okay. Wonderful. Well, thank you. So I hope the mommy to be is listening and she knows that it's absolutely normal to totally sneeze and laugh and to have few drops. Okay.
Yeah.
So switching gears, I'm going to talk about COVID a little bit because if somebody is pregnant or breastfeeding, how safe is it for them to get vaccinated and boosters?
Yeah, so we're recommending that all of our pregnant patients currently get vaccinated, and those who have been vaccinated to get boosted. When the FDA gave their emergency authorization for the vaccinations, at that point, the CDC started a surveillance program, and they were checking and they were enrolling people who got vaccinated. And from the moment of vaccination to, until now, basically, so for 2 years they have been gathering data on side effects. And several 100,000 women in that group were pregnant or became pregnant during this time period. And they've had no complications at all from the vaccination. However, during that time period, anecdotally, we've seen a lot of patients get COVID and become very sick. And most of them do okay, but there is a subset of women who get gravely ill and have to be hospitalized. And, when you weigh that, the risk and the benefit, absolutely 100% get vaccinated. Please do. Yes.
Okay. So we have a question from our Facebook Live, one of the viewers and listeners. They want to know, I'm going to go to that question in a bit since we are talking about vaccination. One more question related to vaccination. If somebody is pregnant and during the pregnancy they become positive, what steps they should take to make sure the pregnancy, nothing happens to the pregnancy and to the mommy?
Yeah, so initially, when you first get tested and say you have some mild symptoms, your management is exactly like anyone else who has been exposed to COVID and is COVID positive, meaning you want to quarantine, you want to monitor for symptoms, and the symptoms that would most affect the baby would be a very high temperature, so greater than 101, or respiratory distress. So those are the two things that could harm the baby. If you have a high temperature, take Tylenol and bring that temperature down. If you have shortness of breath, that's dangerous for both mom and baby. So those people need to go to the emergency room and get evaluated. And ideally, they would go to the emergency room of a place that is a tertiary care center that has a level 3 neonatal ICU in case baby needs to be delivered early or baby has complications. So I will say this, that in my own experience, and the data also confirms this, that most women who have mild cases of COVID, their babies are not affected in any bad way by the COVID, by the disease itself. Their babies are born healthy and sometimes even have antibodies. So that's good too.
Okay. Oh, wonderful. Yeah. So that was actually my question, that if by chance they had to deliver the baby, what are the chances the baby would be COVID positive?
Yeah, so many of the babies are actually not COVID positive when they're born, even when the patient is symptomatic at the time of delivery. And in some cases, the mom is very sick, very symptomatic, but baby is not very symptomatic at all. So yeah, it's a very, very interesting phenomenon there. Yeah.
That's very comforting to know that the young newborn baby is healthy. Wonderful. Thank you so much. Now I'm going to go back to the question that we got from our Facebook Live. So the question is, I am 40. I have fibroids and heavy bleeding and short period cycle and 2 C-sections. In the future, this if in the future this becomes a big, and if uterus need to be removed, is it possible, or what type of method they need to follow, and what would be the effects?
So absolutely, it is possible to remove your uterus with 2 C-sections and fibroids. That we do that every day, so that's not a problem at all. There's various different ways that can be done as well, and it can absolutely be done in a minimally invasively, meaning with laparoscopy or robotic techniques, where you don't have to stay in the hospital for a very long time. There may be some pre-treatment required for that. There are other ways to handle fibroids. There are a multitude of ways. It doesn't always have to be removing the uterus, and that might also give relief of your bleeding issues, with the prolonged and frequent cycles. You can remove the fibroids themselves surgically. There are some non-invasive test techniques with ultrasound waves that we're using now. There's a variety of different ways. Yeah. So yes, you have lots of options. Yeah.
Wonderful. Well, hopefully you got the answer you were looking for. If you have any follow-up questions, we do take questions during our Facebook Live. So I'm going to move on to our questions next segment. You said that there are annual exam, as the name mentions, it's once a year. So, but if somebody has to examine themselves at home, like, just to check, like mammogram, we start
breast
getting
exam.
letters. Yeah. So what happens, like, how can somebody do their breast exam at home before they go to, like, if they are not due for an annual checkup?
Yeah, so actually the recommendation by the American College of OBGYNs is that a woman after age 21 should get an annual clinical breast exam by the gynecologist, and then do a self breast exam once a month. And then starting at age 40, and this varies from different medical group, but American College of OBGYNs recommends at age 40 to start the the screening mammography. But at home, you should do a self breast exam. And I recommend doing them, every month after the period, because prior to your period, you may have some changes to your breast, which might be alarming to you. So, and the way to do the breast exam is to do it in the shower when your hands are soapy and wet, so that they slide over the tissue more easily. And you usually start at the sternum, which is that bony area of your chest. And you move into the armpit, the axilla. And you move in a circular fashion and you cover all of the tissue in between. And you're checking for bumps or lumps that are not easily mobile, that are not soft. You also want to be aware of what the breast tissue looks like. So you want to take a look in the mirror before you get into the shower and make sure that there's no dimpling of the skin, no change in the color of the skin. So it shouldn't be thickened or reddish in a certain area. So those are some things that you want to look for. Yeah.
Well, wonderful. I'm sure a lot of people are benefiting from this information. So thank you so much. I did have a question about mammogram, but you did answer that every medical provider have a different age, but 40 is a good age. So after 40, we should definitely get a mammogram.
Yeah, it's recommended an annual. So the American College of OBGYNs. Now, the cancer societies recommend a little bit differently, and internal medicine may have their own recommendations. So that's what I meant by the different medical groups. But American College of OBGYNs recommends an annual screening mammogram once a year starting at age 40.
Got it. Okay, sounds good. So coming back to the period cycle, usually if someone is on periods, they should not be pregnant, but can someone get pregnant while on periods?
Not on a true period, no, because what's going on with the period is that the lining of the uterus is shedding, and that is the place where the baby basically starts to grow, right? It has to embed in the lining of the uterus. So if it's a true period, no, you cannot get pregnant on your periods. Sorry, no, that doesn't happen.
Okay.
Yeah.
Okay. So when you say it's a true period, like you mentioned, sometimes, if the cycle is 21 days to 20 days to 35 days, you mentioned. So if somebody gets a period between that cycle, so that would be considered a not true period?
Well, it really depends on how long. So sometimes people, and this is also considered abnormal bleeding, but sometimes people have breakthrough bleeding where they spot, from time to time. And so sometimes that could be an early sign of an early pregnancy or an abnormal pregnancy. So at the point that they're bleeding, it's unlikely that they get pregnant. But if their bleeding is sporadic and it's just a breakthrough spotting here and there, somewhere within that time, there's the possibility. Yeah, there is the possibility.
Wonderful. Thank you. So in the beginning, you did mention something about pap smear. So I would like to ask you, what's a pap smear test and how frequently one should do it?
So a pap smear is a screening test for cervical cancer. And there's a variety of different ways that we do it, depending on age group. So 21 is when we typically start, and 21 to 25, we do a pap smear every 2 years or so. 25 to 30, it's every 2 to 3 years, usually every 3 years, depending on other circumstances, social circumstances. And then after 30, the new recommendation is to go as far as every 5 years, as long as it's being done in a specific way where we do co-testing. We check for the virus that causes cervical cancer, HPV, at the same time as doing the pap smear itself. And the pap smear itself is taking cells from the cervix and then sending it off to a lab that will then take a look at the cells and tell us whether they are normal cells or abnormal cells. So it's a screen that way.
Okay, wonderful. Well,
Mhm.
thank you so much. Let me check if we have any questions from the chat. I don't see them. Well, with that, we will be wrapping our women's health section today. I just wanted to tell our viewers and our listeners that eGlobalDoctor is one complete healthcare platform solution for all your medical related issues and questions. And you can have all these services available to you at your fingertips without breaking your bank. They are on LinkedIn, Facebook, Instagram, Pinterest, YouTube, Twitter, or go to the old fashioned way, which is eglobaldoctors.com. I did mention in the beginning that if you are living in US, Indian origin, and if parents are traveling and visiting to US, if you need medical consultation, eGlobal has it for you. Access to doctors from USA and India. Specialist services included. Prescriptions will be provided. Response time is 1 to 3 days. Family members can participate via video physician consultation from any part of the world. It would be a 30-minute consultation, a video consultation. No restrictions on pre-existing medical conditions. This is really big one. No restrictions on pre-existing medical conditions. In-app messaging and ID and portable health passport available. So it was really wonderful talking to you. I know that my knowledge has increased tenfold. So before
Thank
I
you.
let you go,
Mhm.
any word of wisdom that you would like to share with our listeners and viewers?
I would say live the best life you can, take advantage of every opportunity, but always be safe. And if you have any questions about your health, because your health is your most valuable gift that you have, always go in and see your doctor and get things checked out. Don't live with the worry. That's
Wonderful.
my two
Well,
cents.
there you have it. This is Kunjan signing off. See you guys. Sayonara. Till we meet again. Stay tuned, stay safe, and keep smiling always. And thank you, doctor, for your time. Thank you.
Thank you, Kunjan. This was lovely. Thank you so much.
Likewise.